table number 8. Today we are going to discuss about the muscles of the adductor compartment of the thigh. The first one being gracilis. The origin of the gracilis is medial margin of the lower half of the body of pubis, adjoining anterior part of inferior ramus of the pubis. It is inserted into the upper part of the medial surface of tibia between the insertions of sartorius and the semitendinous. Next, pectineus. Origin, pectineal line. Pectineal surface of the superior ramus of the pubis. Insertion, pectineal line extending from the lesser trochanter to the linear aspera of the femur. Next, adductor longus. Anterior aspect of the body of pubis in the angle between the pubic crest and the pubic symphysis. Inserted into the medial 1/3 of the linea aspera. Next, adductor brevis. Origin, anterior surface of the body of pubis, outer surface of the inferior ramus of the pubis between the gracilis and the obturator externus. Inserted into the line extending from the lesser trochanter to the linear aspera and the upper part of the linea aspera itself just lateral to pectineus. Lastly, the adductor magnus. It has two parts, the adductor part and the hamstring part. The adductor part, outer part of the ischiopubic ramus, and the hamstring part, inferior lateral part of the ischiotuberosity. Insertion, medial margin of the gluteal tuberosity, linea aspera, medial supracondylar line and adductor tubercle. Nerve supply, all of the muscles here have a common nerve supply, that is obturator nerve. But the pectineus and the adductor magnus are considered to be hybrid muscles. Pectineus has femoral nerve and obturator nerve as its nerve supply. Adductor magnus, the hamstring part, has nerve supply from the tibial part of sciatic nerve, and the adductor part has nerve supply from the obturator nerve. Now talking about the action, all of the muscles of the adductor compartment have a common action, that is adduction. But apart from that, there is gracilis, which helps in flexion and medial rotation of the leg. Pectineus, adduction and flexion of the thigh. Adductor longus, adduction and medial rotation of the thigh. Adductor brevis, just the adduction of the thigh. Adductor magnus, adduction and medial rotation of the thigh, along with weak extension of the hip joint.